Welcome once again, and today we are going to talk about preconception care. All the things that every woman must know before they get pregnant. This is part of our series that we should talk about in regards to maternal child health. So for you to have a healthy baby, you must have this information about preconception care. So when we talk about preconception care, is the knowledge or the care you must have before you decide to get pregnant. And preconception care starts with medical assessment. So ideally, before you decide to conceive, you are supposed to visit a doctor, and the doctor realizes that you're fit enough to conceive. The doctor will take history, and they know some risks that you have that may hinder your pregnancy, and they might decide whether you should get pregnant or not. Conditions may include hypertension or sickle cell. So when you are to get pregnant and you have a condition like sickle cell or rheumatic heart disease, you need very good assessment before you decide to conceive. Otherwise, the pregnancy might be more dangerous to your health than the disease itself. So you must have a doctor's assessment before you decide to get pregnant. Now, the second part of preconception care is nutritional advice. Before you decide to get pregnant, you must first have knowledge before and know that it's dangerous to be pregnant with a BMI that is above 25 or that is above 30. You should know the foods that you eat that contain nutrients like folic acid, like iron. That will help you before you decide to get pregnant. Before you get pregnant again, you should, if you have the resources, decide to have immunization of the diseases that are easily transmitted from a mother, a child. And those might include hepatitis B, hepatitis C, rubella, measles. So you must make sure that you screened for those and you have been immunized against those diseases. The next thing that should be part of the preconception care should be what we call genetic counseling. So before you decide to get pregnant, you must first visit a well-established and trained medical practitioner, and we discuss about the different conditions that are genetically transmitted from one generation to another, and we reduce the risks of transferring those diseases. In particular, if you had sickle cell in your family and you get a spouse that also has a positive family history of sickle cell in their family, high chances are you might get a child with sickle cell. It's also common in other conditions like dwarfism and some other conditions. So before you decide to go for conception, you must first have genetic counseling. That is, trying to find out if you have given genes that your spouse also has that might result into having an offspring with a disability. Those disabilities are preventable, and if we decide to prevent them, it is very possible. So genetic counseling is part of our preconception care. Now, after genetic counseling, we should have laboratory investigation. And so these are things that we do which might hinder your conception, or if there should be managed before you decide to get pregnant. And the following diseases are supposed to be screened before you get pregnant. One, you are supposed to come with your spouse after having counseled genetically. You do the genetic screening first. You screen for the genes that the doctor had maybe identified during the history taking that would somehow, somewhere link you to having genetic abnormalities. So part of that is commonly done in my country here, Uganda, is sickle cell screening, and it is very much prevalent in the Buganda region compared to other regions. So it's very important that you do sickle cell screening before you decide to get pregnant. The investigation that is also very much important is blood grouping. In particular, I also want what we call rhesus factor compatibility. If you have a rhesus factor negative mother, you should be aware before you get pregnant, such that you receive some drugs that will prevent your body from fighting against the blood of your child in case you give birth to a rhesus factor positive child. So rhesus factor and blood grouping are very much important. Number three, we are supposed to screen all diseases that are transmitted from mother to child vertically, and in medicine we term them as torches. So torches include toxoplasmosis, they include rubella, they include measles, they include HIV, they include hepatitis C, hepatitis B, among others. So all those diseases are supposed to be screened to make sure that you cannot transmit to the child. And now there are other diseases that can prevent you from getting pregnant. So if you have a pelvic inflammatory disease or blockage within your tubes, you might be not in position to be pregnant. So part of the preconception care is ruling out things that would stop you from getting pregnant, and basically they will include having a pelvic inflammatory disease, or having a tubal blockage, or having not a disease but an abnormality in one of the following. This might be the anatomic structure of your reproductive tract, or some abnormalities within your ovaries or the pituitary gland. So we normally do imaging to look for patency of the tubes. If your tubes are patent and you are able to be pregnant and give birth. And we also check for hormones, basically to see if you have all the hormones that are responsible to make sure that you get pregnant. And then finally, after screening all that, we go to manage those conditions in particular. And if they are well managed, the next thing that you're supposed to do is know or have knowledge of when are you most likely to get pregnant. So you're supposed to know when we term someone infertile or when is someone fertile. So you're considered infertile if you've spent a full year of having regular sex and you're not conceiving, regular unprotected sex and you're not on family planning and you're not conceiving. So for that full year, that is considered infertility. One of our videos we shall be looking at infertility, either primary infertility or secondary infertility. We shall be looking at that. So after managing the conditions that you come with, as we said, so you're supposed to know your ovulation day. In the modern world, we have ovulation kits that we probably use to know when you're most likely to get pregnant. So what is ovulation? Ovulation is the day when we feel that your ovum is mature enough that if when met by a sperm, you're most likely supposed to get pregnant. And during preconception care, you're supposed to know the signs of ovulation, which we shall discuss in our preceding videos, that you must know, such that you are able to look for a child on the right day. And then finally, as part of our preconception care, is you having the supplements that will ease your conception. And if you conceive, ideally, they would help pregnancy to be a smooth one. And part of those is that every mother that plans to get pregnant should be started on folic acid that presents neurotube defects, but at the same time it aids in blood formation. In front, we shall come to understand that very many mothers go into dilutional anemia when they get pregnant. So preconception care helps us prevent all that. So in summary, what is involved in preconception care is, one, we are supposed to have knowledge about conception. We are supposed to screen and treat diseases that come with, that would stop us from conceiving. We would screen for genetic challenges and we do genetic counseling. We would screen for your hormones and we are sure that you have adequate hormones, and do some imaging that would aid us to rule out any other abnormalities. You are supposed to have nutritional assessment and nutritional support to avoid obesity, which is a very big risk factor for infertility, and at the same time, if a mother conceives, they are at a very high risk of ending up in a cesarean section. Finally, in preconception care, we treat all those diseases and also provide supplements that would aid in having our mothers pregnant, with providing them knowledge with when should they most likely expect a child. In the next videos, we shall be looking at uh, antenatal care. If this mother gets pregnant, what is antenatal care? What we expect of antenatal care? We wish you all the best. Thank you so much.